Welcome to Her Weekly Fix. I'm Dr. Laura Pipher, naturopathic doctor, and every week I'm here to give you a quick, no fluff dose of the latest health insights, science backed tips, and real world solutions to help you feel your best. Whether it's tackling hormonal chaos, digestive struggles, or low energy, we'll break it all down in 10 minutes or less. Let's get into this week's fix. Today, we're talking about uterine fibroids, non cancerous growth in the uterus that can lead to heavy periods, bloating, pelvic pain, and fatigue. They're incredibly common, but what's not common is how little women are told about why they form. And the traditional explanation hormones, especially estrogen and progesterone. And yes, hormones matter, but your microbiome, especially the one in your gut and your vagina, may be playing a much bigger role than you've been told. So let's start with the gut. Your body naturally makes estrogen, uses it, and then sends it to your liver for processing. From there, it should be excreted mostly in your stool. But this pathway depends on something called the estrobolome, which is a collection of gut bacteria that help regulate how much estrogen gets reabsorbed or eliminated. Here's where it gets interesting. Some bacteria in your gut make an enzyme called beta glucuronidase. That enzyme can reactivate estrogen in your gut and send it back into circulation. So instead of getting rid of it, your body ends up recycling it. And when you're reabsorbing more estrogen than you need, that estrogen can feed fibroid growth. Things like a low fiber diet, chronic stress, frequent antibiotic use can shift your gut bacteria in a way that increases beta glucuronidase and raises estrogen load. In fact, newer studies show that women with fibroids often have gut microbiomes that look different from women without fibroids. More inflammation, different bacterial patterns, and more of those estrogen recycling bugs. And for years, we assumed that the uterus was a sterile environment. We thought that there was no bugs in there at all. And now we know that that is not the case. In fact, in healthy women, both the vagina and uterus are typically dominated by lactobacillus species, bacteria that help maintain a productive and acidic environment and support immune health. But women with fibroids actually tend to have less of those protective strains and more of the ones linked to dysbiosis, like lactobacillus inners. Let's pause there. Lactobacillus inners isn't necessarily harmful, but it is a weaker defender. It's often found in women with bacterial vaginosis, and it doesn't produce the same level of protective compounds as other lactobacillus species. So, what does that mean for fibroids? It suggests that the local immune environment in the uterus and the cervix is less stable. That may not directly cause fibroids, but it can create a perfect environment for chronic low grade inflammation. And inflammation is a known contributor to heavier bleeding, more pain, and worsened fibroid symptoms. So, should we be treating fibroids with probiotics? Not quite. We don't have enough data yet to say that probiotics treat fibroids, but we are learning that supporting your microbiome, especially in the gut and vaginal tract, can be part of the bigger picture. Because when your microbiome is out of balance, your hormones have to work harder, your immune system stays on high alert, and inflammation becomes the background noise your body can't quiet. In other words, fibroids are not just a hormone issue, they also may be a microbiome and inflammation issue. So, what can you do? Here are 4 places to start. Number 1, support your gut with a fiber rich, anti inflammatory diet. Think leafy greens, berries, beans, and flax. Number 2, avoid unnecessary antibiotics, which can disrupt both the gut and vaginal flora for months. Number 3, consider probiotic support, especially if you have a history of yeast infections, BV, chronic bloating, or have recently used antibiotics. But as always, speak to a healthcare provider to make those decisions. And 4, ask your provider about hormone testing. If you're experiencing other signs of estrogen imbalance, like mood swings, sore breasts, or irregular cycles. And if you're navigating fibroids, don't stop at hormones. Your gut and vaginal microbiomes could be part of the picture, and addressing them might be part of the missing link between managing symptoms and feeling like yourself again. If this sparked questions for you, send me a message. I always love hearing what resonated or where you're feeling stuck. Until next week, stay empowered and stay curious.